I am Ayan De Asi Sabirola, and this is my advanced physical assessment examination video for NR 509 for submission to Chamberlain University.
I'm Angelo Sabarola, and I consent this video recording for submission to Chamberlain University.
I am Vanessa Basilio, and I'm holding this recording device for this assignment.
And I'm going to do a 360 environmental scan. Those are my tools on the bed. And I'm using no devices, no notes for the completion of this assignment. Q. I will be starting with a visual inspection of Angelo's face and head. And I note that his skin has no lesions, no discolorations. His head is atraumatic, it is normocephalic, and it is in a midline position. I will be palpating his lymph nodes, starting with his preauricular in front of his ears. Let me know if at any point there is any pain. Post-auricular behind the ears, the occipital behind the head, and to the front, the tonsillar. The submandibular under the angle of the jaw, the submental under the chin, the anterior cervical, the posterior cervical, and the supraclavicular lymph nodes. And there is no tenderness, there's no enlargement, and they are equal bilaterally. Now I will be assessing his trigeminal nerve, which is cranial nerve number 5, and it has 2 components. The first part, the motor, I will be asking him to clench his jaw. Good. And there is good strength bilaterally of his masseter muscles. And then I will have him close his eyes for the sensory portion and identify where he feels me touching him.
Forehead, nose, chin, right cheek, left cheek.
Good, and he identified those all correctly. So the motor and sensory portions of the trigeminal nerve, which is cranial nerve number 5, are intact. Now checking his facial nerve, which is cranial nerve number 7, I will have him do a series of expressions, starting with a smile and a frown, and raise your eyebrows up, puff out your cheeks, and pucker your lips. And all those movements were symmetrical. Now I will be assessing his ears, and they are symmetrical and no signs of trauma or deformity. And I will be using the otoscope to visualize his external auditory canal. I will be pulling his ear up and back. And I see that there is no cerumen, there's no redness, there's no swelling, there's no discharge along his external auditory canal. There's no blockage, and I can see the tympanic membrane at the very end. It is a nice, healthy, pearly gray, and there's no effusion of the middle ear. I will repeat that on the other side, pulling up and back. And I will visualize in his external auditory canal has no blockage, no cerumen, no discharge, no swelling, no redness. And his tympanic membrane is a healthy pearly gray at the end with no effusion. Now I'll be palpating his pinna. Any pain or
No.
there? Okay, there's no tenderness, there's no nodules or masses, and the same for his tragus, no nodules, no masses. And then I will be performing the cranial, a test for the cranial nerve number 8, the acoustic nerve, by using the whisper test. I will ask Angelo to cover his right ear with a hand, and I will whisper here behind him, covering my mouth. I'll be saying 3 words, and he will repeat what he hears. 1, 2, 3.
1, 2, 3.
Good. Now switch to the other side, and I will whisper.
4, 5, 6.
And he identified those words correctly. So his acoustic nerve, the cranial nerve number 8, is intact. Now I will be assessing his eyes, and they are symmetrical. I don't see any nodules, no edema on his eyelids, no ptosis. And I see that his conjunctiva is pink, moist, and intact, and there is no injection. His sclera is clear and white. And now I will test his optic nerve, which is cranial nerve number 2, and it will be assessing the gross visual acuity. I will first assess his central vision using the Snellen pocket chart. And I will stand 6 feet away in front of him and ask him to cover one eye with his hand and then read the smallest line that he can.
LTFTH.
Good. And now switch to the other. There you go.
LTFTH.
And now with both eyes open.
LTFTH.
Good. And his he has 20/20 vision with his right eye, 20/20 with his left, and with both together. And now I'll be assessing his peripheral vision, still cranial nerve number 2. And because we're at the same eye level this way, I'll have him stay seated. Turn a little toward me. Thank you. And I will do that by, can you see my hands right
No.
now? Okay. Well, tell me when you do.
Yes.
So this side, can you see them right now?
No.
Tell me when you
Yes.
do. Good. And from the bottom, can you see
No.
them? Okay.
Yes.
Good. And his peripheral vision is intact. That's for cranial nerve number 2, the optic nerve. Now I'll be checking his oculomotor nerve, which is cranial nerve number 3. And I will be using a light source, and I'll be checking for pupillary response. So I'll have you look straight ahead, and then look straight ahead just at me, and I will shine the light coming in from the side. Good. And the other side. Good. And his pupils are equal, round, and reactive to light bilaterally. And then I will be checking his extraocular eye movements, which involve cranial nerve 3, the oculomotor, 4, the trochlear, 6, the abducens. And I will be using an H pattern. So look straight ahead, just staring at my nose and following my finger with your eyes. Good. All the extraocular eye movements were intact. Now I'm going to be checking his nose, and I see that it is midline, straight, with no trauma. And again, I will be using the otoscope. And I will tilt the tip of his nose up using my thumb, and visualizing his nasal turbinates here to the lateral aspect. I can see that it is pink, moist, and intact. There is no redness, no bogginess. And then medially, his septum is straight and with no deviations, it is intact. And I'm going to check the other side. So the lateral aspect, I will see his turbinates, and they are pink, moist, intact, no redness, no bogginess, no swelling. And then medially, his septum has no deviation. It is straight and intact. Now I will be palpating his frontal sinuses. Is there any pain?
No.
And then his macular, any pain?
No.
Good. And then now we'll check his mouth and throat. Still using my light source. And I see that his lips are symmetrical and is pink and intact. Open your mouth for me, please. Thank you. And looking into his mouth, I see that his teeth are all intact. There's no cracks, no signs of decay. His gums are a nice healthy pink. There's no redness, no swelling, no discharge on his gums. His tongue is pink, moist, and intact. And there is no patchiness, no lesions. Lift your tongue up for me, please. The floor of his mouth is pink, moist, and intact. No lesions, no nodules. And then his buccal mucosa on either side is pink, moist, and intact. His hard and soft palates are moist, intact, and a healthy pink. His posterior pharynx, flatten your tongue now. Thank you. His posterior pharynx is pink, moist, intact. There's no exudates, and his uvula is midline. Now I'm going to be testing his, not testing cranial nerve number 9 just for the purposes of this exam. That is the glossopharyngeal nerve, and that controls the gag reflex. I will be testing cranial nerve number 10, the vagus, by having him opening his mouth and saying, ah. Good. And his uvula and his soft palate rose symmetrically and with phonation. That is intact. And then I will have him stick out his tongue Move side to side. Thank you. And that is his cranial nerve 12, which is the hypoglossal, and his tongue had good side to side movements with no deviation. So it is intact. And then I will be checking his TMJ, the temporomandibular joint, palpating and open and close your mouth, please. Good. I checked for crepitus, any clicking or subluxation, and there was none. Now, moving down to his neck, again, visualization. I see that it is midline. It is straight, no signs of trauma, no lesions on his skin. I will be checking his trachea, and it is midline, and I do not feel any masses or nodules there. And then I will be checking his thyroid gland by identifying first the landmarks. So there is the cricoid process up superiorly and the suprasternal notch inferiorly, and between that is the thyroid gland. And I will retract one side, palpate the edge, and swallow, please. And I feel it rise, and there are no nodules or masses. And then I do that on the other side, palpating the border, no masses or nodules, and swallow, please. Thank you. And there it went up. And now I will be checking his carotid arteries on either side of his trachea, but I will be palpating them one at a time. And that is 2+ and bounding, also 2+ and bounding. And then I will auscultate the arteries, the carotids, using the bell of the diaphragm, the bell of the stethoscope. And I will ask Angelo to hold his breath when, as I auscultate, so it doesn't distort any sound. So take a normal breath, breathe in and hold. Good. And then breathe in and hold. And there are no bruits on his carotids. Now I'll be checking the neck range of motion by active range of motion by having him do a flexion by putting his chin to his chest, extension looking up to the ceiling, and lateral flexion with your ear to the shoulder to the other side, and rotation by looking over your shoulder. And that neck range of motion is intact. Now I'll be testing his cranial nerve number 11 by having him shrug his shoulders against resistance, and that is good, strong movement, equal bilaterally 5 out of 5 strength. Now I am going to be listening to his heart sounds, and I will stand this way. I will first use the diaphragm of the stethoscope. I will start with the aortic valve, which is at the best heard at the second intercostal space, right sternal border. The pulmonic valve at the second intercostal space, left sternal border. Erb's point at the third intercostal space, left sternal border. The tricuspid at the fourth intercostal space, left sternal border. And the mitral valve at the fifth intercostal space, left sternal, mid-clavicular line. And there is no abnormal heart sounds. There were no rubs, no murmurs, no gallops. Now I'll repeat that, this time using the bell of the stethoscope. So aortic valve, second intercostal space, right sternal border. Pulmonic valve, second intercostal space, left sternal border. The Erb's point at the third intercostal space, left sternal border. The tricuspid valve at the fourth intercostal space, left sternal border. And the mitral valve at the fifth intercostal space at the mid-clavicular line. And again, there were no abnormal heart sounds, S1, S2 noted, no rubs, gallops, or murmurs. Now I will be assessing his anterior chest. Visualizing, I see no deformities, and his chest expands symmetrically with inspiration when he breathes. Now I will listen to his anterior lung fields, listening to 6 areas. Just take normal breaths. And his lung sounds are clear in all fields, and there is no adventitious breath sounds. Now I will check, have him turn his back toward me, and I will be checking his posterior lung fields. And I will be starting here on the left, above the level of his scapula. And make sure to go to the lateral portion to get his right middle lobe as well. And all posterior lung fields are clear to auscultation with good air movement throughout, with no adventitious breath sounds. Okay. Now we'll be checking the upper extremities. I will have you hold out your hands like this. And I am checking for any redness, for any lesions, discolorations of his skin, any swelling along his joints, and there is none. I will be checking his capillary refill by pressing down at the nail bed until it blanches and then releasing. And the blood return is less than 3 seconds, which is the expected normal finding. I will do that on the other side, blanch that, and then the return is less than 3 seconds. I'll be hold your hands like that, and I will be checking your radial pulses, and they're a good 2+ and equal bilaterally. Now I'll have you grip my hands and squeeze, squeeze, squeeze. Great, and that is good strength bilaterally, 5 out of 5 strength. Now I will be checking his passive range of motion of the shoulder. And for range of motion, for the purposes of the exam, I will be doing it unilaterally. So good, thank you. And that's flexion of the shoulder, and that's extension. And we have internal rotation, external rotation. We have abduction, taking it away, and adduction, coming back in. And that is complete intact range of motion of the shoulder. Now I'm going to be doing the same for the elbow, passive range of motion. That's flexion, extension, and that is intact. I'll have you hold up your arms like this, and I'll be checking the strength of his biceps and his triceps. So I'll have you push against my hands. Good. And then pull in. Good. And that is good strength bilaterally. 5 out of 5, and they were equal. Now I'm going to check your deep tendon reflexes by using my reflex hammer here. And for that, I will put his arm supported with mine. It is relaxed, and I'm carrying the weight of it. And I will put my thumb at the anterior, medial aspect rather, of his antecubital fossa, and I will give a little sharp rep. And you saw that. Okay, that is intact. And then let's hang your leg right there, and I'll check his patellar reflex. Good. And then good response there. And for his Achilles, I will slightly dorsiflex his foot. And good. So we saw some pronation there, and that is his deep tendon reflexes intact. Now we will move to cerebellar coordination. So I will have you touch your thumb to your opposite fingers. Testing coordination here. Good. Go faster. Lovely. Now put your palms down on your thighs, and then switch it to the front, and then do that fast. Thank you. Good. And so his cerebellar function, his coordination is intact. Now at this point, we will move to the bed. I'll move these. You head over here. Watch your head. Alrighty. I'll move closer to me. The edge. Thank you. Okay. And here I'm going to be exposing his abdomen so I can get good visualization. And I see that there's no distortions, no masses that are visible, and his abdomen, there's no distension. His abdomen is flat. So I will start by auscultating his abdomen, all 4 quadrants, to assess his bowel sounds. And there's normal active bowel sounds in all 4 quadrants. Now I will assess for the arteries that are in the abdomen. And again, I will be listening with the bell of the stethoscope. I will start with the descending aorta, which is at the midline beneath, below the xiphoid process. And then his left and right renal arteries, which lie above the line of the umbilicus. So the left here to the left lateral, here to the right lateral. And then the iliac arteries, which are below the line of the umbilicus, left lateral and right lateral. And they are all negative for Bruys. Now I will percuss his abdomen, listening for any unexpected tympany, dullness, or flatness. And there is none. Now I will palpate. Let me know if there's any pain. I'm checking for masses, for any tenderness in all 4 quadrants. And any pain?
No.
And there was no pain. Now I will palpate the liver, inserting one hand underneath, right at the costovertebral angle. And then with the other hand, I am placing it right under the line of the rib cage and at the midclavicular line. And then I'll have Angelo take a breath and hold. And I'm pushing in and trying to palpate the border of the liver. And an expected finding is either you don't feel it at all or slightly. And I do feel his border slightly, and that is a normal finding. And then I'll do a palpation of the spleen. Turn laterally toward me just a little bit. There you go. Okay, that's good. All right, here. And I will use this hand again to right at the edge of the costovertebral angle, and the palpating hand under the left rib cage at the mid-clavicular line. And I'll ask Angelo to take a breath and hold. And I will push in, up and in, to try and palpate the spleen. And I cannot feel the spleen, which is the normal finding. Wonderful. Okay, now I will be moving on to the lower extremities, checking his skin for any lesions, discolorations, varicosities. There's none. There's no edema. And I will be checking the passive range of motion of the hip. For this, again, unilaterally, and I will not be checking the extension of the hip. So passive, so that will be flexion. And then I will abduct it, take it away, forming out, and adduction coming in and crossing the midline. And this is going to be internal rotation and external rotation, and that is all intact. I will be checking the passive range of motion of the knee, and that's our flexion, extension, good, and that's intact. And I'll be checking the strength of his lower extremities. Bend your legs, very good, and push against my hand, good, and pull, good. And that is 5 out of 5 strength bilaterally. Checking the passive range of motion of his ankle, and that is plantar flexion, dorsiflexion, plantar flexion, and rotation, and that is intact as well. And then I was checking his strength. So push up against my hands, push up against my hands, good, and push down. That's good, plantar flexion there. And 5 out of 5 strength, bilaterally equal. And then checking his dorsalis pedis pulses. All right, they are palpable. Okay, now I'll have you sit up. Thank you. Actually, go all the way, stand up, and I will be checking his back, checking his spine for any unexpected curvatures or alignment, while also palpating on either side of the spine for any tenderness, masses, or nodules. And there is none. There's no unexpected curvatures or alignments. And then I will check his range of motion by asking Angelo to bend your spinal range of motion. Bend yourself at the knee and touch your toes. That's good flexion. And try to extend back. That's extension, good. And lateral flexion side to side. and then rotation at the waist, and that is all intact. Now I will check for his Romberg, and I will have him close his eyes and then let him watch for any imbalance, and there is none. Now, before I check his gait, I am going to check his Bloomberg, which I will have you lie down really quick. Okay, and angling my hand 90 degrees, I will press down and then a quick release. Is there any pain?
No.
Any pain?
No.
Good. Okay, you can stand up again. And that is a negative Bloomberg. And stand up. And then I'll have you walk forward, turn and walk back. And his gait is coordinated and steady. And that is the conclusion of this exam.